So good afternoon. We're here today to outline our updated budget proposal for fiscal year 2021. This updated budget plan reflects the new realities associated with COVID-19, but continues to make significant investments in education and economic development, and it does not raise taxes. As you all know, we filed an FY21 budget proposal what seems like a very long time ago, back in January. But since then, obviously, as everybody knows, the world has changed in a big way. As is the case for all other states, COVID-19 has created significant budget uncertainties here. The Commonwealth's projected revenue for fiscal year 21 dropped by about $3.6 billion, according to new projections that we were required under state law to release today. We also extended several tax filing and payment deadlines to reduce the burden on residents and businesses, which further scrambled the revenue picture this spring and this summer. Fiscal 20, as we've talked about before, is basically fine and will be put to bed hopefully at some point when we wrap things up with the legislature there. Along the way, we faced unexpected budget costs as we responded to this pandemic, which included a number of programs that are funded with both state and federal funds. There's about $1 billion through Mass Health to help stabilize healthcare providers, nearly $50 million for field hospitals, a total of $90 million that we were committed to deliver to our contact tracing program, $56 million to address food insecurity, and $350 million to support PPE acquisition and distribution. It's pretty obvious early on that the drop in revenues and other factors would significantly impact the budget picture, which is one of the reasons why we in the legislature decided to issue a series of one-month budgets until some of the smoke cleared with respect to what fiscal 21 would actually look like. Although I would remind people that in the midst of that, we did file and the legislature did enact a year's worth of unrestricted general government aid for cities and towns and Chapter 70 funding for education. But fortunately, in many ways, thanks to our fiscally disciplined approach to budgeting over the past few years, we had a number of tools in the toolbox to help us respond to this challenge. The biggest and most significant benefit of that fiscal discipline is the fact that we've managed to triple the size of the state's rainy day fund, which today stands at an all-time high of $3.5 billion. In fact, when we signed last year's budget, we added another $500 million to that rainy day fund. We've also worked to find budget savings over the past few years, and we've worked particularly hard to rein in the growth of the big cost drivers associated with the Mass Health program. That careful approach to budgeting has allowed us to build up reserves and to deal directly with the difficult times we're now facing without going back to the taxpayers. The hard work of reining in the budget over the past few years allows us also to invest in priorities that matter now more than ever in economic development, public health, and education. The budget we're submitting today is a $45.5 billion budget recommendation to the legislature. That updated budget makes significant new investments in Main Street economies and our pandemic response and in our schools. The budget also sustains support for important services like healthcare, local aid, and transportation. And the funding is available to support these programs and especially will be applied disproportionately to communities that have been affected particularly hard by the virus, including many of our communities of color. And we're doing this again without raising taxes, especially because of the current state of the economy, and the idea of going back to the taxpayers given their own situation just didn't seem like the right thing to do. Some highlights from the budget plan. First, let's talk about education. Since the beginning of the pandemic, we've made about $1 billion in state and federal resources available to local cities and towns, much of it so that they can safely get kids back to school. Today, we're also proposing $5.3 billion for K-12 public schools to local municipalities. After recognizing the significant level of federal funding that was made available to districts, year over year, K-12 education spending is more than what was originally proposed in our budget from January, which fully funded the first year of the Student Opportunity Act. We're particularly proud of this achievement. A lot of people rightfully worried that with the passage of the landmark education funding bill, we wouldn't be able to meet those obligations. On economic development, we worked pretty hard to develop a program to support main streets and small businesses. Back in June, we announced a revised economic development package called Partnerships for Growth. That $275 million package aims to promote future job growth and empower local cities and towns to recover from the economic challenges caused by this pandemic. That is currently in a conference committee. We anxiously look forward to having a chance to signing that bill and putting it to work. The budget we're submitting today supports that plan with an additional $100 million in economic development initiatives that aim to provide workforce development improvements, better connect workers and businesses, and support small businesses. Some key aspects of this economic development initiative include $35 million for grants for small businesses and an additional $3 million for technical assistance for small businesses. And these will be particularly focused on supporting minority-owned and women-owned and veteran-owned businesses. There's another $35 million for community development, financial institutions, grants and loans, another $15 million in matching grants for capital investments by small business, $7.5 million for technical assistance and grants, including for small businesses, online and digital tools, and $6 million for regional recovery planning grants, which is an increase of $5 million over fiscal year 20. The Economic Development Initiative will be funded by changes that modernize the sales tax collection system for the first time in decades. These changes do not increase the amount of sales tax to be paid, and they only apply to a handful of the largest corporations that do business in Massachusetts, but the revised payment schedule will create a one-time increase in tax revenues. Our budget calls for putting these funds to work for small businesses and Main Street economies. Our budget also focuses $8.4 million in new funding that will help support our efforts to transform vocational high schools into career technical institutes. This was a major initiative in our original FY21 budget. This initiative will train 20,000 new workers in skilled trades over the next 4 years, and we believe this program is more important now than ever as workers are looking for secure, better-paying jobs. The budget also advances the recommendations of our Black and Latino advisory commissions, and especially investing in these programs at this point in time is more critical than ever. And despite the turbulent fiscal environment for state government, we must continue to promote economic empowerment, especially for people of color across the Commonwealth. The budget continues to make significant investments in workforce development, education, and small business support, which were all recommended by the Black and Latino advisory commissions. On housing, earlier this week we announced a comprehensive plan to provide support for residents and families to help them avoid evictions and foreclosures during these unprecedented times. The budget proposal we're announcing today builds on that and includes $123 million for the Mass Rental Voucher Program, $72 million in funding for local housing authorities, and $182 million for emergency assistance associated with our family shelter system. On health care, in addition to sustaining the public health investments we've made to battle COVID-19 that I mentioned earlier, this budget also includes $160 million to support Chapter 257 human service provider rate increases, which is a significant investment that reflects the important work done by these providers, especially during this pandemic. It also includes a 10% increase in funding at Mass Health, which will support the increased caseloads due to COVID-19, as well as costs associated with our public health response. A total of $316 million to combat substance misuse is also going to be filed as part of this budget, which continues our work to battle the opioid crisis and other addiction issues as we confront this pandemic. There are several other important areas of investment as well. $1.2 billion in operating funds for the MBTA, which is in addition to the T's 5-year, $8 billion capital plan to upgrade, modernize, and improve their system. a total of $386 million for the Massachusetts Department of Transportation, including full funding of its snow and ice budget, and $20 million for the Massachusetts Emergency Food Assistance Program to further our efforts to fight food insecurity. Thanks in part to the work we did to build up our reserves and our responsible approach to budgeting generally, this revised proposal enables the Commonwealth to make significant investments in our recovery while continuing to fund key services that support our continued fight against the virus. We look forward to continuing to work with our legislative colleagues as the budget process moves forward, and we remain committed to supporting all of our residents throughout this public health emergency and the ongoing recovery. Before I close, I want to thank Secretary Mike Heffernan and his entire budget team at the Executive Office Administration and Finance. Special tip of the hat to Catherine Hornby and her team for all of their works. And I also want to point out how incredibly hard they've worked, not just on this budget, but on so many different elements associated with the Commonwealth's and our municipal partners' financials over the course of the past 9 months.